I'd like to start by introducing Dr. Brandon Eden, Assistant Professor in Medicine, Population Health Sciences at Weill Cornell. In clinical practice, he provides addiction treatment and primary medical care to patients with substance use disorder. He's the Program Director for the Nascent Addiction Medicine Training Program at New York Presbyterian, Weill Cornell, and is the CHERISH Pilot Grant and Training Corps Director. Welcome, Brandon. The floor is yours.
Thank you. Welcome, everyone. So I'm just going to share my screen here real quick. So as Jared said, I am the director for the Pilot Grants and Training Corps for CHERISH. So today, the meeting schedule, I think really probably about an hour, but we may end a little earlier than that. But today is just a chance for everybody to ask questions, us to give you a little introduction to the center itself, and sort of how the pilot grant process works for us. And we also have a couple of former pilot grantees with us today, so they'll be able to ask questions for people. But it really is sort of a Q&A for you guys to sort of ask questions and if you have any learn about the project itself. So this is sort of a rough timeline. So as I said, I will sort of introduce you to CHERISH and then sort of introduction to the pilot grant process as well. And then we will move into our Q&A with our pilot grantees and then sort of open up to everyone. So just to give everybody a little orientation, I don't know how many people have ever heard of CHERISH prior to receiving this email or the pilot grant. So CHERISH is the Center for Health Economics of Treatment Interventions for Substance Use Disorders, HCV and HIV. It is a multi-center NIDA-funded center of excellence, a P30 center. Our focus is on developing and disseminating health economics research in the areas of healthcare utilization, outcomes, and health-related behaviors to inform treatment for substance use disorders and HCV and HIV. So in addition to the pilot grants, we do offer sort of multiple other services, and I do encourage you, if you're interested, to sort of go to our website and sort of explore and sort of see what else we have available. So we do have trainings. We do in-person trainings that are scheduled occasionally. We also do have online trainings that are available. So there are modules on our website if you want to go on and look at those and peruse and sort of see what's available currently. And also if you want to like sign up for our listserv, you can sort of hear about future things as well. In addition to that, we have what's called our CHERISH Research Affiliates, which is a network of people who are working in this field, who are associated with CHERISH, and sort of allows them to sort of network with each other and sort of provide support to each other. In addition to that, we have other resources, including our consultation service. So our consultation service is for people who are working in this area and just have questions, maybe specific questions, or need some help or assistance as they're thinking about, writing a grant or thinking about economic aims for their grants, or are sort of writing up their current research and sort of wanting help or guidance with that. That is a free service for anybody who's interested that provides you sort of 6 hours of consultation services with one of our experts within CHERISH or our research affiliate group. As pilot grantees, you will have access to all of these resources. So that includes meeting with Dr. Sean Murphy, who is the director of our consultation service, potentially connecting you with additional researchers within the network as well. And then you'll be meeting with Dr. Bruce Shackman, who's the director of CHERISH overall, and myself, sort of quarterly through the first year of your pilot grant, and sort of touching base about additional resources that you might need or services we can provide you through CHERISH. That's sort of a global overview of what CHERISH is and sort of what we offer in general. Moving on to the pilot grants, which is the purpose of today's sort of meeting. CHERISH, this is our ninth year of providing pilot grants. So pilot grants are up to $20,000 for 1 year of research, focused on obviously research in the area of health economics or health outcome research for substance use disorders, HCV and HIV. We provide a total of 5 grants per year. 3 of those are open to any institution. 1 is specific to Weill Cornell Medicine, and 1 is also specific to UPenn. In collaboration with the Penn Injury Science Center, and specific to their sort of research needs as well. Okay, so eligibility, just sort of broadly overview, pretty much anybody is eligible if they're affiliated with CHERISH in some way. So postdoctoral fellows, trainees, one sort of category who apply, and that's most of our pilot grantees are often sort of in this bucket of people who apply, and they apply under the mentorship often of a CHERISH investigator or CHERISH research affiliate. You can also be more senior investigator who's affiliated with CHERISH in some way, or nominated by CHERISH investigator or CHERISH research affiliate. And then finally, one of our own internal CHERISH investigators or research affiliates. If you don't sort of have a CHERISH investigator or CHERISH research affiliate already that you're connected to, please, just going to answer this now, please feel free to reach out to us at any point and we can sort of make those connections for you. We can talk about that too in the Q&A if people have questions about that process. All right. So this is the application timeline. So we are open at the moment to receiving letters of intent. So the LOIs are due in January. So you can go to the website, you can sort of see what that entails. It's sort of a very brief description of what the project you're intending. And then the proposals will be due in February. And then we do our review process March through middle of April, and then announce our funds beginning of May, who was funded at that time. Just a little bit of background for this process as well, just sort of as you're thinking about this, if you're sort of trying to figure out if your project fits within CHERISH or fits with us, please feel free to reach out to us at any point. We're happy to sort of meet with you or talk through that process to make sure if you're ever having any issues as you're going through this process, we can sort of help do that, because we would like to help you submit the best applications possible. All right. So this is what the letter of intent includes. So as I mentioned, it's sort of a introduction of who you are, your career stages, demographics, that sort of thing, and then a brief overview of the project, less than 600 words, and then the project fitness. So this is the if you have issues or questions about how you fit in the within CHERISH's goals, these are sort of the main topics we're looking at. So one is our PI is eligible. 2, does it fit the CHERISH mission, so related to health economics research. 3, it fits within the NIH priorities, and if it is related to HIV, does it fit within the NIH HIV priorities as well? And then, as I mentioned, the full proposal is due in February. So this is a normal sort of pilot grant application and the same structure as any NIH application process. So there's the research plan, which is the bulk of the application, references, human subject timelines, disseminate plan. It is not a sort of full grant proposal in that it's sort of somewhat limited. It's limited to 6 pages, as opposed to some grants which are much longer. And then budget support, et cetera, which is sort of normal budget justification, the biosketch, letter support, that sort of thing. And then relevance, again, will be part of the application as well. For this section, when you're doing the pilot grant application, it'll be 1, how is this pilot grant sort of helping you in your career, specifically for people who are like junior investigators, trainees, postdoctorals, how is this going to sort of help you progress in your career? How does it fit with the CHERISH mission, and then the NIH priorities for both health economic research as well as HIV, if that's the case. And then we will talk about our special topics of emphasis this year, and then this would also be when you would say how your pilot grant fits within those priorities for us this year. All right. So these are our special topic interests this year. So just caveat before I go over these, you do not have to, if your pilot grant doesn't fit one of these, that's fine. You can still apply as long as it fits within the CHERISH mission. But these are the ones that this year we're sort of looking or trying to get applications for. So if you have one that's in one of these areas, we would encourage you to apply very much this year. So drug overdose preventions, including but not limited to opioid overdoses, so looking more broadly. So methamphetamines, et cetera. If you work in the field, you may know that methamphetamine overdoses have increased drastically in the last few years, so things like that. Looking at syndemics of substance use with HIV, Hep C, and related comorbidities. So these can be medical comorbidities, increases in skin and soft tissue infections, endocarditis, that sort of thing as well. Harm reduction strategies. And then finally, contingency management for treatment of stimulant use disorder specifically, but for substance use disorder as well. All right. After the applications are submitted, this is sort of the proposal review process. So these are the same criteria that NIH uses for applications when you're applying for a regular NIH grant, which is sort of useful for people, particularly if you're junior in your career, have not ever done an NIH application before. This is sort of a way to sort of learn how that process works and how they sort of evaluate applications, sort of give you that sort of chance to see how that process works as well. So it'll look at significance of the application itself, investigators, innovation, the approach, environment, and overall sort of a rank. And then we will evaluate who meets subjects, budget, and additional comments, that sort of thing as well. All right. So I know I sped through that relatively quickly. I'm happy to go back to slides, but I'm going to introduce our pilot grantees first and let them sort of talk about their experience with the pilot grant application process as well as with the pilot grants. And then we'll sort of open up to Q&A for our former pilot grantees as well as for myself. I'm going to introduce Dr. Ali Jalali first. So he's a PhD researcher in health economics. His pilot grant was prenatal opioid exposure, neonatal abstinence, opioid withdrawal syndrome, healthcare utilization costs, and economic burden. Dr. Jalali?
Thank you, Brandon. Thanks everyone for joining. I think my pilot grant experience was quite fruitful. I had a kind of a different sort of outcome than I think most folks were, because my pilot grant was somewhat self-contained, but one of the nice advantages of the CHERISH pilot grant is that it sort of very much is structured just like sort of a NIH grant proposal, which is fantastic experience for a young investigator, especially as me as a postdoc who going into the job market after receipt of the pilot grant. It was a great way to sort of express experience in funding opportunity, but also that it has a lot of flexibility in terms of what sort of required outcomes there are. Just to give a sort of approach, I'm an economist, and my study was to look at health economic outcomes of neonates who were exposed to opioids in utero, and looking at those outcomes 6 months after delivery, as well as to develop sort of unit costs that would be incorporated into some of the other research that I'm involved in actual applied cost effectiveness study. Originally, my study was sort of going to look at a smaller sample using the new generation of Medicaid data, but the funds that I received, I was able to pool with other investigators to sort of purchase a larger pool of data, which we are hoping to continually use for multiple projects. So I think those are the sort of the two things that I wanted to sort of express sort of starting off, is both the experience that you get, since it's very much structured like an NIH, but also that this grant, given this pilot grant, has some flexibility if you want to have some more than just sort of a self-contained project. Yeah, so I'll pass it back to you, Brandon. Oh, you're muted.
Sorry. Thank you. Up next is Dr. Rachel Epstein. She's a physician researcher. Her project was Medicaid state hepatitis C treatment restrictions and spillover effects on continuity or care cascade. Dr. Epstein.
It's thanks for asking me to be here, and exciting to hear all the great CHERISH developments in the pilot grantee grant awards. My project was really, or the CHERISH pilot grant that I applied for was really the first grant I applied for, other than the T32 fellowship that I was doing at the time. And as Ellie said, it's a great sort of like intro grant. It has, I don't know if someone else has sound on the background, but it was a great intro grant. So it was good to practice the steps of writing all of the aspects of an NIH grant without it being as long and as intense of a process of writing a K, writing an R, anything like that. And so it was also, I really enjoyed sort of the networking through, I think that was probably the best part for me of the pilot grantee experience. So meeting Brandon, meeting Jared, meeting everyone from CHERISH, both in terms of the other pilot grantees, people sort of in my cohort, as well as meeting people within CHERISH leadership and everyone in between, and then being involved in a number of different CHERISH related mentoring sessions and other things since then has been just a great experience in networking. And through that, or combination of through the pilot grant, through some of the other networking, started doing projects with some other investigators through CHERISH and sort of led to different things. My pilot grant was also really helpful as some foundation for my K award. And so it was a great place to get some pilot data, learn how to do some key methods and work with a new data set, as well as each of the specific learning things. The sort of media training and everything was great to really understand how to do, how to try and publicize articles and everything too.
Yeah, thanks for mentioning. I was going to mention a couple of things I forgot to mention about sort of after the pilot grants, and you guys can give your input too, after you receive your pilot grant, sort of the things that happen in that year and follow up. So as I mentioned, there are sort of quarterly check-ins with myself and Dr. Shackman, who's the director of CHERISH, but a couple other things. One, you do meet with Sean Murphy, who I mentioned is the director of the consultation service, but you also go to Penn, meet with the LDI, Leonard David Institute at Penn, and get some training and guidance around dissemination and policy. What did you guys think of that experience?
Yeah, so maybe I'll go first, Rachel. I think the dissemination piece is really important. One part is that when you become a pilot grantee, whenever you publish even papers that aren't related to the pilot grant, the CHERISH has a really great social media dissemination team, and they'll retweet or tweet out your papers sort of multiple times, as well as creating blog posts regarding your paper. So that's a really good way of getting folks' eyes and attention to it. And I think CHERISH has a strong following and a large research affiliate network, so that kind of helps to get some attention and get your name out there. Because a lot of academic medicine, as I perceive it, is what kind of folks you know and how people are aware of your research, since grants and other things are becoming more and more collaborative. So I think the dissemination piece was really fantastic. I don't recall the name off the top of my head now, but I did meet with some folks from the dissemination core to discuss how to sort of come up with ideas in terms of writing papers for news articles or newspapers, because that seems to be a way that your actual results, because a lot of folks, I'm guessing here, will be interested in their work having some policy impact. And it's nice to get those results and your work sort of on the eyes of actual policymakers, because as much as we would like to, no one's reading sort of technical field studies. And if your study shows up in like the New York Times or even a local paper, that might have a much greater impact. And I was able to sort of strategize about different methods. For example, if you can even write up an article when there is some policy being proposed, let's say at the State House, that your study can contribute to, then you have something sort of ready, prepared to be submitted, because those kinds of articles, one of the chances of it being published is if you can get it to them right at the contemporaneous sort of moment and when it's sort of most impactful. So the dissemination arm of CHERISH, I think, is just top notch. And I think I see Bonnie is here on the call, so I wanted to give her a shout out as well.
Did you have anything to add to that, Rachel? Or
no, I think some of the same things. It's a great experience, and I'm still trying to learn how to be better about being more active on Twitter. And it was certainly a great experience going through that training. And I will try and be better. Sure.
All right, so we are going to open it up to sort of questions for everybody at this point. Looks like we have one for you, Rachel, already in the chat.
Yeah, and sorry, I realized I kind of went right through the intro into sort of more about the project and more about the program than the project. But so the project that I did, or sort of just background in general, the type of research I do in general, I'm an infectious disease physician and at Boston Medical Center and Boston University, along Marielle, and I focus largely on pregnant women, women of reproductive age, and children and adolescents. I have a med-peds background in terms of my training. And I also do work with, so I do database work and sort of cascades of care, as well as decision analysis and cost effectiveness analysis. And so my project for CHERISH was specifically looking at the Medicaid state treatment restrictions that are differ by state and require that people have a certain degree of either liver disease or absence of substance use to actually treat them for Hep C. And I did an interrupted time series to determine whether Hep C screening or Hep C treatment actually increased or decreased in a commercially insured population based on the timing of the changing of or sort of loosening of those Medicaid restrictions in the same state. So if Ohio, for example, changed its got rid of its restrictions in 2016, looking to see did that change were more people treated or screened after that restriction was loosened in the commercial insured population in Ohio. And we actually did find that there were differences in screening, but not treatment that spilled over into the commercially insured populations. And the idea of that was just to see could Medicaid restrictions and Medicaid policy actually affect what's happening in commercially insured populations, and sort of as an overall thing, is that something that we sort of makes these policies even more discriminatory because it's not affecting just the Medicaid population, but also commercially insured individuals. And that was published in American Journal of Preventive Medicine this summer. And that was something that also was really useful because I used the market scan database, which is something that a number of CHERISH investigators have used through sort of access through CHERISH as well. And it was great to be able to learn how to use such a large data set and the sort of the limitations and advantages of it as well.
All right, so we have a couple other in the chat that I can answer. So does CHERISH consider alcohol use disorder in its definitions of SUD or as part of the center's remit? So technically alcohol falls under the NIAAA. It does not fall under us because we're NIDA funded. That being said, obviously alcohol use disorder and substance use disorders, there's a significant overlap. So if your focus is strictly on alcohol use disorder, that probably would not fall under us. But if it's sort of alcohol use disorder in relationship to other substances, sort of overlapping or comorbid conditions, then yes, it would be something that we could still address. And the next one, is this an individual grant or an institutional? So it is to the individual. The person at the institution would be the PI. And if you're at a US institution doing US research, you should be eligible even as a non-US citizen. So that is okay. All right. Any other questions?
I have one again. I'm Marielle Baldwin from BMC. I'm just wondering how for any of the past investigators, whether you worked something out as far as dedicated or protected time with your departments once you got the funding, or how sort of does that work? I know you have dedicated funding, but how did you kind of include this in your time with your work in the department?
Great question. I can take that on first. For me, I was on a T32 for most of the time that I received the CHERISH pilot grant. And so I couldn't receive anything towards salary stipend-wise, because if you're on a T32, you can't receive other NIH-related funds. And Brandon or Jared, correct me if I'm wrong, but that's been my experience. And so I use the funds towards the project costs, so data analyst and I believe publication fees and certain things within our group to help publicize as well. And then for in terms of protected time, I was on a T32, so I had 85% protected time through the T32 initially. I became faculty at the beginning, and I'm realizing in retrospect, I wonder if I could have used some of that to some of the CHERISH pilot grant funds to get a little bit more protected time, because I didn't have a ton that first year of faculty in the midst of the early part of COVID. So it was kind of a crazy year, and that's something that I think in general, and again, Brandon, Jared, correct me if I'm wrong, I think some of it potentially can go towards that and getting a little bit of protected time if you're able to receive the funds because you're not on a T32 or similar.
Yeah, so I think just to answer that question, in our pilot grants, it's sort of a mix of people sometimes using it for salaries, sometimes using it strictly for, by getting access to large databases or that sort of thing. So it sort of depends on what your needs are. So if it is sort of actual funding for your salary, that's something we can sort of talk about individually as well if you have questions about how to work that out. But it can be used for a range of things. And as I said, it's probably about 50-50 people using it for salary support versus just for specific things to support their research. I don't know. Did you want to talk about that question, Holly? Or
I was going to see if you needed. I mean, my pilot grant went straight. Almost 100% of it went to a sort of a pool to purchase data. But I mean, it's an important point. I think when I put the grant, I was still had another year of postdoc, and I think my postdoc there was some protected time in terms of training that I could have been used to this. And it's important. I think one of the challenges on my end was that. As we mentioned, sort of as being a new investigator and non-faculty, you get a chance to really understand how the sort of grant process works, and you can get experience rewriting something that has those components, significance, innovation, etc. But I understand that some of these administrative delays when you engage the funds for a team that could, once you get the data, you're now have a faculty and you're on multiple projects, and it's harder to sort of you kind of wish you had some of that money into your FTE. But again, I think the flexibility of it being a pilot grant was great because I could, we have that data and I could sort of use it for other kind of purposes. But mine went all strictly to data purchase.
And there is as well, there is some flexibility, as they both mentioned, in the pilot grant. So, after you're awarded the pilot grant, things change, obviously, for various reasons. So sometimes the money gets shifted around for different reasons. So either maybe previously was part of your FTE, but now it's going to get shifted because the data costs more than you anticipated, or vice versa. You don't need to use it for purposes you thought you did. You can shift it to FTE, either for yourself or for support staff. So if you have a research assistant who's sort of helping you, that sort of thing. So there is some flexibility with that as well. So I'm going to answer the question from Jennifer. Is tobacco considered as SUD, or is a relationship co-occurring use? So tobacco does fall under NIDA purview. So yes, if it is strictly tobacco related, that is still okay. Jared just posted one of our former pilot grantees did research specifically on tobacco. Eligibility is based on being a trainee of the CHERISH investigator affiliate or being nominated by one. How is this process usually looks? How one could be nominated? So anybody can sort of apply. If you're not already connected to a research affiliate or one of our network, please feel free to reach out to us. And generally what will happen in that process, that's part of the reason we have the LOI process and why it's sort of extended. We can connect you with somebody within CHERISH who would be sort of your research sponsor for that project. So if you don't know anybody in CHERISH, please feel free to reach out to us and we can sort of make those connections. You don't have to have that in place prior to developing a project, although it may be useful to sort of help guide you. But if you don't have one already, that's fine. And we can make those connections for you.
Yeah, sure. Thanks. Just to follow up. So I worked with a couple of CHERISH affiliates but I wonder if I reach out to them directly, what should I specifically ask from them? So is it a dedicated time during my period? Is it a letter of support, or is this a co-authorship and some time based on that criteria as a co-authorship? So yeah, just wanted to prepare myself and prepare my potential mentors slash nominators.
Yeah, so it could be sort of run the gamut of those things. So maybe they're going to be a co-investigator with you, but the minimum sort of that they have to do is say, yeah, this guy's good, project fits, and that sort of thing. And so usually they can submit an LOI, but usually we will also contact them just to make sure they're aware. But if all they're really doing is sort of like helping you review your pilot grant and sort of helping you do that development, that's all they necessarily need. They don't have to have a time commitment. They don't have to have FTE commitment if that's not where they are, what they need. And if you're having issues where they just don't have the bandwidth to be your sponsor or are reluctant to do that, please do let us know. We can sort of make connections as well. But yeah, they're not expected to be co-author or any of that sort of thing if that's not the relationship. But if they are, that's great, but that's not expected.
Thanks.
All right, are there any other questions from anyone?
Yeah, I have a question.
Yeah.
So with these types of research that you're looking for, I know it's a broad range, as I see from the different topics that you listed. Usually, like, is there like a particular range of development that you already have sought out? Like, for example, this is like a stage 4 out of stage 6 type study, or are you looking for something like a little bit more basic? Because this is kind of like a pilot grant, so I'm just kind of seeing like what kind of projects or what range of projects you're typically seeking out.
So we don't necessarily have a specific category. So some people use pilot grants basically as a sort of supplement or adjunct to research, like a bigger research project they're already doing. So maybe there's already ongoing research and they use this to supplement and do some additional economic research alongside another trial. So that's one way to do it. But it can also be truly sort of nascent sort of research where you're just really doing an investigation and thinking about something in this area and be like, okay, and you're trying to create data potentially to go for the next step for your next grant. So it's sort of the range. We don't necessarily have an expectation of where you are in that and how developed the project is. If it's something truly very nascent and you're sort of struggling, trying to figure out how to develop that project or fit with within the CHERISH, then please feel free to reach out to us so we can sort of help you develop that a little more fully as you're thinking about the application, particularly as you're submitting the LOI, just sort of make sure it's going to fit within our priorities as well as sort of help you get what you actually want out of the pilot grant as well. But yeah, we don't have expectations about where it is in the development.
Okay, so in other words, for example, I am a doctoral student and I am interested in looking at criminal justice involved individuals who use drugs, tobacco to cope. So I have not collected really prior data on my own. Is that something you still take into consideration?
Yeah, no, that'd be perfectly fine. So if you're you know, have a specific question you're thinking about and you just need to get that initial data to sort of decide where to go or where the project will, yes, that's perfect. That fits very well.
Okay, great. Thank you so much.
Sure. Are there any other questions from anyone else in the audience?
And before we go, I'm going to take this opportunity, put the eval form in the chat. And if folks are interested and willing to provide feedback, we'd love to hear from you. This is the second time we've done this. And I think I see another question. So I'm going to put that link in the chat and then ask Brandon if he wants to answer this.
Yeah, so hi, thanks. Setting up the meeting. Yes, I have a question. Can I apply with a global health project or should it be a domestic project? So it can be global. It doesn't necessarily have to be, the institution has to be US based. So it sort of depends. That's probably something we'd have to talk about one-on-one to figure out exactly what the project would be. But yes, you can be doing research that does have a global sort of perspective. All right. If there are any other questions, I'll ask if Rachel or Ollie have any sort of last minute comments or any sort of what they liked about the program or what was great about it or not. Otherwise, we'll sort of let everybody go early. But
Yeah, happy to say, I think it was a great experience to go through. It was a great sort of like first grant to apply, more or less first grant to apply for, and also just been great to sort of understand things in terms of like how to do a budget for the first time when it's a relatively small budget compared to a lot of other projects and how to go through. And I think that like the support through Cherish through the entire thing was great, both in terms of the actual meetings to keep you on par with things. We did sort of presentations at the beginning and at the end of what our data was, and got some great feedback from Cherish investigators, and as well all the different the sort of media session and everything, and just the support in general for how to help sort of think about what journal to aim for, how to disseminate, how to really try to make findings, out there for policymakers, and not just getting like it's I think important to reach the community on Twitter and different social media, but also like who are the hands of the people who are actually going to change things, and why are we doing this work? And I think that just learning a lot about that was really helpful, and just really the networking and getting to know all the wonderful people through Cherish and the wonderful work that they're doing, and also getting involved in some of the other Cherish conferences throughout the year too.
I guess I once received some advice from a mentor during grad school that writing a really bad paper that no journal wants to accept is extremely useful, but you have to do it early because then the stakes aren't as high. So I think, the pilot grant, even if maybe the project isn't as well prepared, it's good to get a rejection because you'll get reviews and you'll kind of understand how folks can read these grant submissions. I mean, I've had another rejection, but I kind of learned where there's a certain piece where someone could mistaken or misunderstand what you're trying to do, it'll just stick, and it'll make it difficult to understand, pull out the value of your grant. So some of this, rejection could be useful. And in this one, since it's a pilot grant, it's not as large as some of the other grants. And so, submit. It could be, rejection is useful. Weird kind of end advice, but I think it was good for me to hear that.
All right, thank you. Sorry. Can you give us a sense of how many applications you get each cycle? So it's been growing. Last year, we funded 5. We got around 20 applications, I believe it was last year, like 21 applications. So it's, a roughly 25% funding, 25% of the grants or applications were funded. But as Ollie mentioned, even if your grant is not selected, often you will get feedback on the grant and sort of try ways to make a stronger application if you apply either subsequent years or go somewhere else. But we can also, even in those cases where you don't get, if you didn't get selected, we can try to help you, potentially refer you to other places that might be funding sources, that sort of stuff as well. So even if you're not selected, we are still a resource and can try to help you do that. And if nothing else, we can connect you to our consultation services and that sort of thing as well. So as Ollie said, yes, please apply, even if you're, on the fence about it or don't think it's developed well enough yet. Please do feel free to apply. All right. So if there are no further questions, we'll end it there. Please feel free to do the evaluation that Jared posted. If you do have any questions or want to speak with us one-on-one or sort of discuss your project as you're sort of thinking about it, developing your LOIs and your application, please feel free to email us and we can sort of set up a time to either over email we'll have it or set up an actual time to touch base and speak.
Yeah.
Have a good day, everyone.